Hello, everybody. Welcome to today's Table Talk Live today. I'm Dr. Maggie. And the big question, hot topic today is why don't medications work for POTS, POTS, and what your doctors don't know about it. And that's what we're going to discover today. And some of you might be wondering, what is POTS, dysautonomia, or long haul? Well, we're going to break into that. We're going to go in the deep dive. And without further ado, here we go, everybody. Welcome, everybody. I'm Dr. Maggie Yu. I am a functional and holistic medicine physician and the creator of Transform and the Transform Protocol to turn around POTS, dysautonomia, long haul, mast cell, autoimmune disorders, you name it. Today, top of mind is we're talking about, it's a series that I've been working on for the last month on more information, education, knowledge, and results around POTS. And without further ado, just dig in a little bit about what POTS is. I do want everybody who's watching to give me a boom in chat. Tell me where you're watching from. If you're an alumni and you've worked with me or you're working in one of our programs right now to end POTS, I would love for you to say hello. Tell me hi. I would love to know where you're watching from, that you're watching, and tell everybody how you're working with us, right? And those that are new to me, if you could tell me what are some of the diagnosis or lack of diagnosis that you've been struggling with, put that in chat. That'd be really great. We have a whole team watching the comment section. We have producer Jonathan in the background watching your comments as well. So if you already have questions for me, feedback for me, go ahead and start popping it in the comment section, because you know what? I love talking with you. I don't want to talk at you. Let me take a quick look, everybody. Ooh, I like it. Allison, Kimberly, Kim Miller, I love it. You're watching from Arizona. Thank you. Thank you. We've got Doug watching from POTS, a secondary problem to a root cause, toxins and parasites. Is that true? We have Wrestler with Rip Rogers says self-diagnose, right? And I love this wrestling with RIP Rogers. The question is, do I need a diagnosis? What is she talking about? Do I need that name of that diagnosis to get help for these symptoms? So this is why I want to just talk about, number one, who am I? I'm Dr. Maggie Yu. I have been a medical doctor for, at this point, 28 years. And around the right young age of 36, I came down with early menopause, which turned out later to not be early menopause, to be a whole lot of hormonal and thyroid issues that were related to autoimmune disease. And later I developed symptoms relating to POTS, mast cell, and mixed connective tissue disorder, all of which were tied together. And so I love working with people with hormonal chaos, POTS, dysautonomia, long haul, mast cell, and any autoimmune disorder or disorders you can throw at me. I say, come at me, bro. So I love working with these disorders because once I had figured out that there were multiple root causes, that conventional medical training, which I went through and I delivered care as a family medicine physician, didn't serve or help people with these complex, complicated chronic health disorders. I had to figure out my own way, meaning like, were there things from naturopathic medicine, functional medicine, other branches of alternative medicine that were data-driven, put them together. And you know what? That turned my menopause around, my autoimmune thyroid around, mixed connective tissue disorder, and my POTS symptoms. So it is my mission to help others. And Maya Angelou says this: when you know better, you do better. So today I'm going to share some information around why don't medications work for POTS, right? And to start off with, I would love if you could type down, do you have POTS? Do you know what POTS is? Do you know what dysautonomia is? Do some of you have long haul, or your symptoms were made worse because of an infection with COVID? And you may not even have a diagnosis. Tell me about that, right? Jean said multiple autoimmune, right? EDS, Ehlers-Danlos. By the way, Jean, I don't know if you saw my live that I did a couple weeks ago about the new studies that are coming out that actually has scientific data to actually show that POTS is connected with autoimmune disorders like Ehlers-Danlos syndrome, as well as mast cell and histamine disorders. So, number one, what is POTS? Postural orthostatic tachycardia syndrome. That's the diagnosis name, but it really isn't a diagnosis. It's just a description of symptoms. Postural orthostatic means with positional changes, blood pressure changes, heart rate can change, and people can get a series of symptoms relating to really fast heart rate, really slow heart rate, big blood pressure up, big blood pressure down, that contributes to symptoms like lightheadedness, dizzy, nausea, brain fog, fatigue, unsteadiness, anxiety, you name it. So a lot of these symptoms. And a lot of people don't even realize they have POTS, and neither do their doctors. And the reason is that with POTS, diagnostic testing biomarkers just isn't great at all. So 95% of the individuals I work with don't have the diagnosis. Kim Miller is a good example. Kim says, POTS, Dr. Maggie got me off the majority of medications conventional medicine threw at me. But, I would love to ask Kim and everybody who else who's watching, do you even have a diagnosis, right? I would love a little bit of information about what your diagnostic journey has been, because I find that the number one obstacle people have around ending these symptoms is trying to get a name on it, trying to get a name. Because one of the biggest obstacles with POTS is regular doctors work off of diagnosis, meaning that unless there's a diagnosis, there's a term, there's an ICD-10 code that they can apply to it, insurance won't pay for your blood work, your referral, or even your visit sometimes. So what drives regular conventional medical care, family medicine, internal medicine care, is knowing and figuring out what the diagnosis is first. And unfortunately, many people with POTS get stuck right there. How many of you are stuck there trying to get a diagnosis? How many of you have family members that are stuck there right now? Type it in chat. Because the other pattern that I'm noticing is and Kathy, one of our instructors, was talking about that with me today. There is a huge epidemic and rash of young women coming down with POTS, dysautonomia, or long haul, seemingly out of nowhere, according to them and their doctors. And I can, off the top of my head, think of right now, within the last 3 months, 6 young women that we've worked with in our programs that came down with POTS recently. And I remember just earlier this week, we talked to a young lady, Haley, and she had just had the diagnosis of POTS within the last 2 weeks with multiple ER visits, fainting, cardiology visits, and was started on these medications. I mean, she, based on symptoms, had the diagnosis told she had POTS, postural orthostatic tachycardia syndrome, because with postural changes, she had blood pressure, heart rate changes like that. And a slew of medications, cardiologist referrals was thrown at her. Now, I'm going to ask you out there, did that happen to you or someone you love? And how did that go? How did the cardiologist referrals go? How did the medications go? What medication were you prescribed and what happened with that, right? Robin says, yeah, but I paid for a specialist and he did a 5-hour examination. It was originally for CR, chronic regional pain syndrome, which, by the way, is an autoimmune disorder. So is there a connection with autoimmune issues and POTS, right? So I have a big, bold claim here, okay? My claim as to why medications don't work in POTS is because POTS is not a cardiology, a heart and blood vessel problem. And yet, this is what patients show up to the emergency room, primary care, internal medicine doctor's office with, and that's who they get referred to. And the only tool a cardiologist have is cardiology meds. And if it's not a heart problem, maybe that explains why heart medications don't work. This isn't a maybe, this is facts. In recent research too, reviewing what the treatment of care is I'm going to go into medications in a second. It really talks about how limited and how ineffective or ineffective. My producer will probably tell me. Ineffective.
Dr. Maggie, it's ineffective.
Thank you. Jonathan, our producer, is here. Thank you for that. How ineffective, even studies out there show that medications are ineffective at treating the symptoms of POTS. Because what are the symptoms? Really, really rapid heart rate. And what would be the cardiology solution for that. What medication? Some of you have medical background. Some of you have taken these medications. If you have really fast heart rate because of these positional changes, that's a heart symptom. The first type of heart medications that would be thrown at you would be, wrestling said it, same thing. Okay, metoprolol. Any of these medications that have prolol behind it, metoprolol, labetalol, these are medications we call beta blockers, okay? I'm going to ask a question here, which is why, when you're looking at, Kimberly says beta blockers. Okay, why don't beta blockers work for people with POTS, dysautonomia, and long haul? By the way, why am I adding dysautonomia and long haul is that POTS with these symptoms is in the same family of illnesses that is also called dysautonomia, which gives you a hint. Dysautonomia is dysregulation of the nervous system. Nerves, not heart, right? And long haul, which is COVID, beyond 12 weeks, still having symptoms. And guess what those symptoms are? Blood pressure changes, heart rate changes, fatigue, dizziness, fainting, increasing allergens and allergies, gut response, right? So guess what? All three of the top symptoms of long haul, dysautonomia and POTS, describe the same syndrome. We're really talking about the same thing. And none of these three syndromes are related with cardiology, the heart. It's not a heart problem. So Megan says, my cardiologist just prescribed propranolol for me to try. I'm scared to try it. I get it. I would love anybody else who had a beta blocker for POTS to share with Megan what your experience has been. I've talked to thousands and thousands of people. I have turned around POTS for, at this point, 876 people and counting. We're going to be hitting over 900 by the end of this month. And so I know after talking, we've done a lot of POTS assessments and POTS report cards for people we've talked with. And if you want to get your POTS assessment and know like what's really going on with your POTS and where you need help on, there's a link here. I just wanted to put, I just don't want to forget this. If you want to scan this QR code and book a call with our team, see what's your POTS report card. What are the areas that you really need help in? Just scan that and you can book a call with our team. We can take a look at what's going on with your POTS. Okay. Now, I do want to go back before I hit the why beta blockers don't work for POTS is this. Yaz right here, just in time says beta blockers dropped my blood pressure too low and I was dizzy as hell. Okay, I'm going to explain a scientific mechanism here. Okay. It's not a heart problem. Then what kind of problem is it? Well, in POTS and in dysautonomia is even a better term to describe what's going on. Dysautonomia means that there's a nervous system imbalance. We have a sympathetic nervous system and we have a parasympathetic system. Sympathetic is fight or flight. Parasympathetic is calm, rest, and digest. And they're supposed to be sitting here like this. In cases of POTS and dysautonomia and long haul, there's something causing the sympathetic nervous system to fire like crazy. So that's a nervous system hyperdrive, and the brakes are not coming on with the parasympathetic nervous system. No brakes. Cannot balance it out, right? Now, that's something to consider right here. It's a nervous system dysregulation, one of the major causes. But I'm also going to be talking about how it's not just a nervous system imbalance. Underneath this, there are other issues at play like hormone problems, as well as other super triggers like infection, like COVID, for example, and genetic links to autoimmunity that we're just missing. But let's go back to this whole nervous system and the heart symptom here and beta blockers. Okay, who's ready for the beta blocker conversation, right? Let's talk beta blockers. Yeah, I like this. So beta blockers are designed where one of the main mechanisms, they do two things, okay? Beta blockers are really good at slowing the heart. Okay. So is it good for people with what's called tachycardia, fast heart rate? Would that be good? Does that make sense? So as a doctor, as your cardiologist, you got a fast heart rate and they got you dizzy and you almost fainted. Would giving a beta blocker make sense? Yeah. That's why they're the first line of care that we do in the emergency room in the cardiologist's office. Now, there's a second mechanism of beta blockers. Second mechanism of beta blockers, besides slowing down the heart, is it also lowers blood pressure. Because think about it. When you have a higher heart rate, it can also keep your blood pressure at a certain rate or even raise your blood pressure because your heart is working harder. The pump is working harder, right? So when you apply a beta blocker, yes, number one, it slows the heart rate. But when you slow the heart rate, meaning slow the pump, what happens? The pressure in the whole system drops. So it doesn't just slow the heart, it dramatically drops blood pressure. Now, what would that do for someone with POTS? Meaning that when they go up and down, they get dizzy, their blood pressure goes up and down already. Their heart rate not only goes fast, but goes slow, swinging back and forth because it's a nervous system disorder, right? So, what do you think taking a beta blocker is going to do for most people with POTS, right? Yeah, right. And Craig even says it lowers my oxygen saturation, making me feel terrible. Well, Craig, because there's less blood flow, right? We're actually taking a beta blocker and saying, oh, the heart rate is really fast. Let's treat the heart rate, the symptom. And then let's crash the entire system by lowering that blood pressure, which lowers the delivery of oxygen, oxygen saturation, you name it. So the side effect of a beta blocker in someone with POTS is slower heart rate, which is intended, but also a dramatic drop in blood pressure, which is awful for someone with POTS. So in the vast majority of cases of people who have POTS or dysautonomia, when they get prescribed a beta blocker, it doesn't work. In fact, it makes them worse. So how many people have had this situation where the medication actually made them worse, right? And Ingrid said, my blood pressure was already being regulated by other medications before they gave me the beta blocker. Because some people already with POTS have an underlying blood pressure problem and they were already on medications to lower blood pressure. And then you throw a beta blocker on top of it. It's like triple whammy to drop her blood pressure, making her worse. In fact, real life case, I was speaking with Tammy earlier, and 24-year-old young woman, with POTS, given a beta blocker, and it dropped her blood. I mean, yes, it slowed down her heart rate, but it dropped her blood pressure so much that she fainted, fell and injured her head, and obviously can't drive, is having problems with activities of daily living without having to faint over and over again. And when they went back to the cardiologist, guess what the advice was? It wasn't to lower the beta blocker or do something else or have an alternative treatment. The answer was telling dad, maybe you should put Tammy in a nursing home right now. A 24-year-old, maybe we should put her in a nursing home right now to keep her safe. That's a side effect of a medication. This is what I call iatrogenic, doctor-created worsening of someone's POTS symptoms because you prescribe the top medication for POTS, which is a beta blocker. Right? I mean, this is crazy, right? And on the MC, you're saying, thank God for you. But this is information that your cardiologist should know, the ER doctor should know, every single doctor you encounter with should know. This should not be new information for them whatsoever. However, when you look at even the latest review from the Mayo Clinic, the top medication advised, meaning the top recommendation for standard of care for POTS is you must give a patient a beta blocker as its first consideration. Does this make any sense? Right? I want to ask you, does that make any sense? I want to make sure you understand now why don't beta blockers work? It's not a heart problem. It is not a heart problem. And you give a heart medication, and now you've created a blood pressure, slow heart rate, real cardiovascular problem by collapsing the blood pressure in the whole system. Big problem here. Okay. And then, Ortho just said, I just got home with, I just got off the phone with the cardiologist. My feet are swelling and black and blue with DVTs, pulmonary embolisms, blood clotting. So cardiovascular, blood vessel problems and issues. Exactly. So let's move on to a second common medication. How many of you are on fludrocortisone, right? How many of you are told that this is a salt-related problem? Eat more salt, drink more water, take a medication that helps you retain salt like fludrocortisone, right? And does that work? Okay, I'm going to ask that question to chat while you guys put it in there. Producer Jonathan said, Lisa Rose says, I have PTS symptoms since 5 years old. I finally talked to a cardiologist and they prescribed me Midrin, and fludrocortisone. Yeah, what are your thoughts on Midrin and fludrocortisone? That's really perfect because that's what I'm going to be talking about. So fludrocortisone is around the whole idea around because I think on the MC was talking about how his feet was swelling. So what about the swelling, right? Some people have swelling. Some people are told that, this is a water and salt electrolyte problem. POTS is not a water salt electrolyte problem. Okay. Because if that was the case, just eating more salt on a regular basis would solve this problem. Taking a medication like fludrocortisone that helps you retain more salt, right, would solve this problem. Now, here's how the medication works. It actually mimics what we call a corticosteroid in our body called aldosterone. And when you when you have more aldosterone created, your body actually naturally keeps more salt in, and more salt in your body helps retain more fluid. Okay, so more salt in your body retains more fluid. So it's an attempt to raise your blood pressure using salt and water retention. Okay, so what would be the side effect of taking fludrocortisone? Water retention, swelling, salt retention, right? Could it provide some temporary relief for someone with low blood pressure? Sure. Okay. Sure. If that was the only problem, because the main problem in POTS isn't necessarily even a blood pressure high or low problem. It's a fast and slow heart rate too, right? It does nothing for heart rate. Okay, so the same person may now be taking a medication and have more salt in their body and more fluid retention. And oh, yeah, blood pressure is a little bit better with that. As long as you keep taking it, as long as you kind of swell and puff up like what do you call it? The Pillsbury Dope. What's that puffed marshmallow man on Ghostbusters? I'm dating.
Oh, the Ghostbuster one.
The Pillsbury Michelin.
It's not the Michelin man. I'll be back with an answer.
Thank you. We're doing deep research over there. But like this fludrocortisone and taking salt in and hoping and praying more water retention is going to be solving the problem is hoping that you look like Puff the Marshmallow or Michelin Man and thinking I'm not going to have POTS anymore if I'm extremely water retention and swollen, that solves POTS. And I'm going to ask, so Stay Puff Marshmallow Man.
Craig Jennings was kind enough to provide the answer. It's a Stay Puff Marshmallow Man.
Thank you, Craig. Don't know you, and I'm so glad you're here for deep research support. Fluidocortisone is a way to use salt and water so that you're the Stay Puft Marshmallow Man. And if that's solved the POTS, you and I don't need to talk about this. It's game over. It's done. It's a salt problem, blood pressure problem, water retention problem. How many people have been solved by that, right? Now, somebody mentioned that I was scared to take fludrocortisone and what are some of the possible side effects and all this stuff. That's for you and your doctor to talk about. But just understand is that that's how that medication works is it helps you keep more salt in your body so that more water will stay in your body. And it will artificially, using the medication every day, keep your blood pressure up just a bit. Okay. And that doesn't solve the problem because POTS is not a blood pressure problem per se, meaning raising the blood pressure a little bit consistently every single day doesn't solve POTS because all these other symptoms with fast heart rate, slow heart rate, dizziness, vertigo, brain fog, right? It doesn't actually solve the real problem in POTS, which I hint at. If it's not a cardiology problem, what kind of problem is it? Write this down. Get ready to write this down. Okay. In fact, I actually did a workshop around this. And if you're interested in seeing a replay of the workshop I did earlier this month about it, type in chat POTS workshop, and we'll get that recording to you where I went over this in more depth. Now, if it's not a heart problem, what is it? Number one is it's a nervous system, autonomic nervous system disorder, meaning fight or flight, rest and digest. Those two nervous systems are not, this is hyperdrive, fight or flight, and the calm, rest and digest is not, the brakes are not firing at all. Okay. So that's the nervous system mismatch. None of the medications have addressed the nervous system mismatch. Okay. The second mechanism, write this down, hormones. The underlying root cause for POTS is hormone chaos. And there's 3 types of hormones, at least 3 types. I wouldn't even go 4. But for sake of simplicity, let's go 3 types of hormones involved with POTS. Okay. Number 1, sex hormones. Number 2, adrenal hormones. Your doctor knows nothing about adrenal hormones or sex hormones. And number 3, thyroid. Okay. 95% of people I work with POTS have a thyroid problem they don't know about, nor their doctors know about. So the second underlying root cause for POTS is hormonal chaos. And I'm going to repeat it. Sex hormones, adrenal hormones, thyroid hormones, none of which your doctors know anything about. And most people aren't being even sent to those doctors with POTS. And even if they did, they're met with like stairs, resistance, and you're crazy, medical gaslighting, because they don't know. Okay. Doctors hate it when you come to ask them about something where you know more about it than they do, or something they don't know about, right? They just haven't been trained to understand. Hormones have something to do with POTS. They really don't, okay? So the second cause is hormones. And then the third cause of POTS, underlying cause, is what I call immune dysregulation. The immune system is going crazy. This is where COVID comes in, or other super infections like SIBO, Candida, comes in, because these super infections like COVID will actually infect your nervous system, your hormone making systems, your gut, to actually cause flare up and cause POTS, just so you know. And your immune system don't just fight germs. It also is there to identify allergens, things that don't belong in here, and says, you're an allergen, you don't belong here. I'm going to fire off tons of histamines and throw allergies into crazy hell. So POTS people have tons of histamine allergy mast cell problems, because that's one of the underlying root causes of POTS, is these histamines that's in response to all these hyperallergenic reactions. Histamine causes blood vessels to dilate. Guess what that happens with that? It causes blood pressure to go up and down like crazy. Histamines will actually cause your heart to have all these irregular contractions. I know, right? Have you heard there's a histamine connection with POTS, allergy component with this, an immune connection with this, right? So far, none of the medications we've talked about, beta blockers, fludrocortisone, does anything to any of these causes. And finally, we're going to talk about the third class of medication called Midrin, okay, which is the Midrin, okay? Somebody had asked about that. If I'm talking to you right now and this is like ding, 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 and there's an aha moment where you're like, that's me, hit me up, tell me in chat, okay? Or am I coming out of left field and I'm talking to myself, okay? As I'm going through this, as I'm also explaining these medications, by the time you've heard me explain these medications and how they work, you're going to know more than the doctor who's prescribing those for you. Just going to tell you that right now. So the medication Midrin is frequently prescribed for people with POTS. And Midrin is what we call a vasoconstrictor. Vasoconstrictor means it takes your blood vessels and artificially, using the medication, constricts it. Okay. So if all the blood vessels around your body starts to constrict, what does it do to blood pressure? Does it go up or does it go down? Type in chat, right? Judith says, me. Thank you. Thank you. I know I'm talking to you. Thank you. Galvan. Oh my God. Are you guys' mom? Is that the Judith? If it is, hello, England. Right? Ingrid, aha moment. Allison says, geez, POTS. And yes, this is me all the time. Okay. I want you to know that, like, I'm not pulling this out of, you know what, this is real people. I mean, we are talking to at least 100 people a week dealing with POTS and dysautonomia. And so this is a familiar story. So you're not a super special rare unicorn. This is actually what everyone, I mean, there's an epidemic, millions of people are experiencing right now, right? Somebody, Samantha wrote that doctors are writing her off as well. Medical gaslighting, doctors writing you off. This is a very real thing. So this is Denise, by the way. Yes, you're spot on. Also, it would raise your blood pressure. Thank you, everybody. So, and this is how I actually interact is I teach, okay? Anybody that's going to be working with me and my team, I'm going to teach you to be smarter than 10 of your doctors combined that you've worked with, period. Maybe 100. Because there is knowledge here that they just don't have access to. So let's talk about Midrin. So if it constricts the blood vessels, what does it do? Temporarily raises blood pressure. So are there POTS people that have, their symptoms are more, yes, they have the fast, slow heart rate, but for some people, do they have more of the symptoms relating with low blood pressure? Yeah. Some people with POTS they have fluctuating high and low blood pressure, but the lows really makes them drop to the ground. Boom, right? And for that person, giving a medication like Midrin to temporarily constrict the blood vessels would raise the blood pressure to keep them from fainting. Could that work for that particular person temporarily to keep them from fainting as long as they take the medication? Yes, right? So because it does temporarily raise the blood pressure. Here's the problem. Most people with POTS, it's not a low blood pressure problem. It's a fluctuating blood pressure problem, meaning there are times it's high, there are times it's low, and it's a heart rate problem with it going up and down. That's not even related to the heart, but there's a heart rate fast and slow. So taking Midrin to temporarily raise your blood pressure could be a problem for someone who's fluctuating high and low, making their highs even worse. How many people with POTS have episodes of crazy ass high blood pressure, right? And if a doctor threw Midrin at you, it's going to make that problem worse. And it does nothing to help the nervous system or the heart rate. So you may temporarily raise the blood pressure, but this person's heart rate's still going up and down, up and down, up and down. And so every time that person's heart rate goes up, blood pressure will change. Every time that person's heart rate goes down, blood pressure will change again, while they're taking a static medication every single day at the same rate, which doesn't solve this fluctuating problem that's going nuts 100 times a day for POTS. So is Midrin is Midrin an effective long-term solution for people with POTS? Type in chat. And if you've taken it, share your experiences. And right. And Kimberly says, yeah, high and low blood pressure is her issue, right? So you just give literally a one-trick pony medication like Midrin, and you raise the blood pressure 20 points. Does that solve POTS for people, right? So I can already tell you right now, based on what I already told you on mechanism of how it works, we already know it's not going to work for POTS, okay? Temporarily, maybe for, for a couple hours, or maybe for the first week or two of someone really fainting with it, could it be a quick Band-Aid to prevent that? Yes, it could. So is there room for short-term use of something like beta blockers, Midrin, or fludrocortisone medication, just to acutely treat with some symptoms to get you out of their office and out of the ER? Yeah, that's why they're so often used. It gets you out of the emergency room. It gets so you can wait for your 6 months or 6 weeks for your specialist appointment, where they do testing that tells you everything is normal and prescribe you more cardiology meds that don't work. So this is the state of affairs for POTS and dysautonomia, and and the top 3 medications that are prescribed. Now, what I would love is for you guys to tell me, what are some of the other meds you've been prescribed for POTS? Because I'm not a one-trick pony. I am a medical doctor, and I do know about all these meds, and I also know about what works. Okay. The focus today is why don't those things work, right? But I also know what works, right? But I would love, are there other medications that you've been prescribed for POTS? I would love to know what your one-trick ponies have been prescribing you. And I can explain to you why those meds haven't worked, right? So this is going to help educate other people with POTS. Anyone, right? I know a lot of the patients that we come have been, because they've been to the emergency room 5-6 times minimum. I remember Sanaya, she had the 3 months prior to her, she's a 24-year-old young woman who was at Yale studying to be a nurse practitioner. And the 3 months before she actually started working with me, she had been in the emergency room, I believe either 7 times or 9 times. I know it's an odd number above 5, okay? And sitting there waiting for a cardiology referral, or has seen a cardiology referral, and symptoms made worse by these cardiology meds, right? So it's really common that these are the top meds that are prescribed, really common journey for people, and it makes them worse. In the meanwhile, are there other medications? So another young woman was given Cymbalta. How many of you, oh, go ahead.
Hi, Dr. Maggie. We had a couple comments in the chat about some medication they'd been on. Kimberly Miller mentioned that they had been on Mestinon.
Yeah.
And then Allison mentioned H2 and H1 antihistamines.
Oh my gosh, really fascinating on that one. So here's the problem, H2 and H1 antihistamines. Oh, I could go on and on about that one, Allison. But really, how many people have been given antihistamines to try to deal with POTS or mast cell, right? By the way, POTS, the third trigger that I talked about was that people with POTS have a dysregulation of their immune system where your normal immune system is supposed to look at allergens, some allergens, and say, you don't belong in here. I'm going to fight you. I'm going to send histamines up, right? But in POTS, studies have shown it's linked to people with mast cell and histamine, really elevated levels of histamine. And the high histamine and high allergic reactions and POTS are totally linked. Most patients with POTS have histamine problems. Well, then doesn't it make sense then you should go see the allergist and let's get you started on antihistamines? Would that be a good answer? Why do you think antihistamines would work or not work? Is there any smarty pants or people who've worked with me in the program who could answer that question, right? Yeah, like Zyrtec medications. How many people have been given Zantac, Tagamet, these medications for mast cell or for POTS? Now, if they worked, I wouldn't be so busy. If they worked, we don't need to have this conversation. But doesn't it make sense if it's related to the hyper-triggered allergic system that giving antihistamines would work? No, right? And the reason it's no is because histamine receptors are various types. And if you're just sitting here and you're just giving an antihistamine, meaning shut down histamine, shut down histamine, shut down histamine, sure, it could decrease histamines in one type of histamine, histamine receptor and one type of histamine, and you could have less allergic reactions, okay? But the problem is there are other types of histamine receptors that are related to digestion. Okay, I want you to hold that thought. Is that too much? Okay. So when you actually take histamine blockers, you're actually blocking, for example, stomach acid production in your stomach, which is needed to break down allergens to decrease histamines. So on one hand, you're like, let's just give an antihistamine. On the other hand, you're shutting off all these digestive steps that actually blocks your body's ability to break down allergens, and it raises histamine like crazy. So in the short run, oh, I might have a little less hives and itching. And then in the long run, why do I have all these increasing food reactions, gut reactions, and allergens or mold reactions? And then everybody's like, oh, it's the mold, it's the allergen. Well, no, it's, a histamine problem that you can't just throw antihistamines on because you're actually making the histamine problem worse by shutting off steps in digestion. That is a huge truth bomb that no one will tell you. Okay. I've heard no other doctor, functional or conventional, ever discuss this point on why antihistamines fail for people with POTS, mast cell, or histamine. Because it breaks digestion, people. It breaks your digestion, which is the most important step in your body to decrease histamine levels. So that's not going to work. It's going to make the problem worse. And I have what I call iatrogenic related, meaning doctor-created increased allergenic reactions in people with POTS, mast cell, and histamine intolerance, precisely because of this approach of prescribing antihistamines. Woo! Right? And Ingrid just said, I don't stay on histamine medications, antihistamines for long periods of time anymore. She can't. She shouldn't. But do you know how commonly doctors are prescribing these medications and how long they put people on it? And then they wonder why, like 6 months or a year later, somebody comes up with a diagnosis of POTS or dysautonomia or new autoimmune disease or mast cell or histamine problem, right? So Craig says, what's the answer? Right. So I just wanted to make sure I follow the loop, finish the loop to let you guys know why these medications don't work so you understand it. Now, I did mention that to recap, if none of these cardiology meds, antihistamines are going to work for POTS, and now I understand why, what does work? Well, let's go back to the 3 underlying mechanisms. Number 1, it's a nervous system dysregulation, autonomic nervous system dysregulation, meaning fight or flight versus rest and digest. Number 2, immune dysregulation, meaning that the immune system is hyper-triggered by infections or hyper-triggered by allergens, right? And then also number 3, which we haven't touched into, is doctors don't even talk to you to ask you questions about Was there genetic predispositions in your family? Were there clues with the immune system, allergy system of your family, hormonal systems in your family, digestion problems in your family? Has anyone actually asked you those questions about your history? I mean, how many of you with POTS, dysautonomia, long haul even had doctors that asked about these types of questions? Well, they wouldn't know the ask, they wouldn't know what to do with the answer. So for me, it's really, that's why it's really important for people to talk to us. And for me, a couple things is that in order to assess somebody to say, well, what would work for you would be to say, well, what's the underlying causes? We have to ask questions like, what are some of the underlying, what's family history? What's your past medical history? What are things that you've tried and haven't tried? What has worked? What doesn't work? And what's your readiness level to really learn about this? This is education. I'm going to tell you here, how many for you that are watching right now, this is the most you've ever learned about POTS in the last 30 minutes, right? 41 minutes to be exact, than I have ever learned from all my doctors combined. I know because people after Mayo Clinic, after Johns Hopkins, after Cleveland Clinic come and watch something like this, and this is what they tell me. I've learned more in that 30 minutes, 40 minutes than I ever have in all those doctors' visits combined. So what would work? We have to address those root causes, right? Which is why on the workshop that I recently did, we talked about how do you address, how do you test? What are the things that you need to do to test, assess, and the tools that you have to deal with autonomic nervous system dysregulation? What are the things that you have to do to calm the immune system from attack, right? What do we do to actually look at what's the environment in your body that's welcoming infection like a welcome mat? Why is that happening, right? And looking at hormones, like we're talking sex hormones, adrenal hormones, thyroid hormones, blood sugar regulating hormones. Like, why aren't your doctors being trained on these things? Because they're not. So that is what works. This is why it's not difficult for me when I work with people to turn around POTS. That's why we're at 876 success cases and counting. And that's what, and I want you to think about that, right? How many doctors have you worked with that have actually been able to assess any of these things, know what testing to do, what the data actually means, what the pattern is in you, and what are all the tools to fix it, right? And just looking at thyroid alone, I did a thyroid training a couple of weeks ago on the connection between POTS and thyroid. How many people saw that? And how many people want to see that? If you have a family history or you have a history of a thyroid disorder, right? Or you suspect that you have, but you've been told your thyroid is normal, then you should watch the thyroid training that I just did, right? Put thyroid, POTS and thyroid in chat, and we could get that training for you, or you could search for it on YouTube. That was about 2 or 3 weeks ago that I did that training. But the answer to that isn't just, do you need thyroid medication or not? Which is what the thyroid doctors are going to tell you. You know what? Your thyroid labs are quote unquote normal enough. You don't need medication. Go away. Well, no, there's actually 20 other tools I have. If 95% of individuals I work with POTS have an underlying, undiscovered, or underappreciated thyroid problem, then are there a ton of tools? Yeah. That needs to go into that? Yeah. Could they need medication? Possibly, that the doctors are unwilling to prescribe. Sure, that's a possibility. Could it be that they need to look at, why is my thyroid so out of whack? Is there an immune system attack on my thyroid, right? Or looking at sex hormones. Why? I was just talking to Cheryl the other day where she was like, wow, my daughter has POTS. And the last time I did have my hormones tested, I'm 56 years old and my hormone levels were like gone. And I was told that's normal. That is not, newsflash, that is not normal. So these are the kind of solutions that really needs to happen that isn't happening out there at all. So I want to tell you that's how come for me, looking at the whole system, the whole body, and looking at out of the box ways to make measurements, look at those patterns and solve them with tools, huge number of tools, is how I turn around POTS. Okay, so I want to ask you guys, what was that super helpful? I want to make sure that I answered any questions that were posed in chat. I don't know if producer Jonathan had any questions that someone had brought up. Taylor's like POTS and thyroid, huge connection. But again, that's one of the hormones that's totally disrupted in POTS, right? 95% of people, right? Perfect. Yeah, and the other thing too is, if you want to talk, the most important thing for you to be like, Yes, I need help. And somebody's asking, should I eat vegan? If eating vegan was all it took to solve the problem, you don't need me. Eat vegan and stay vegan, right? But it's more complicated than that because food allergens get involved, digestion problems get involved, which is why I create a system called food mapping to solve that problem, right? Clonidine, Robin said, that's another blood pressure medication. People keep popping in chat about the blood pressure medications, and clonidine, just like some of these medications for blood pressure, like beta blockers, don't work long term because all it does is it quickly drops blood pressure. But the problem in POTS is actually the swings in blood pressure. Yeah. So how was that? Was that helpful, everybody? I hope that that was helpful. And do you have a deep understanding right now of why medications don't work in POTS? And do you clearly understand why I say POTS is not a cardiology problem? It's not a heart problem, right? And I would love if you could pop in chat. If it's not a heart problem, what kind of problems is POTS? Name one of the reasons I told you that was a big light bulb moment. If POTS is not a heart problem, what kind of problem is it? Because I highlighted 4 main areas, if not more. So pop that in chat, right? Yeah. Someone said thyroid, right? Yep, exactly. Nervous system dysregulation, Craig. Thank you. And if it's a nervous system dysregulation, what about throwing some seizure medications at it? What about throwing Neurontin or gabapentin nerve calming medications at it? Does it work? Because decreasing the electrical firing of nerves doesn't address the fact that they're still fluctuating back and forth like this. And what's underlying causing those nerves to go crazy? Immune system attacking it, hormone upset causing that to happen. So we got to fix the real problems there and not throw more band-aids. Even if you do know it's a nerve problem, throwing nerve calming medications into it doesn't work, right? Ingrid, I love it. Thank you. Thank you. For her, she said hormones, right? As well. And Kimberly just added, it's a digestion problem. People with POTS, 100% of the people I work with POTS have a tremendous, serious digestion problem. So the digestion problem really causes problems with, breaking down nutrients, absorption of nutrients and salts. And it also causes an inability to break down food, which raises the amount of allergens circulating around their body. That's why POTS people have so many allergies and allergens and mold reactions, right? So there's a real dragon underneath that. All right, everybody. So I hope that that was super helpful. And let me just make sure I'm going right there, everybody. Jonathan, if you could help me with sign up, that'd be great in a second.
Okay.
Thank you. So what I want to make sure is that a couple things, okay? You know now why medications don't work. You know what the real, it's not a heart problem, and you know what the real cause is underneath it. And I went over, well, what works, okay? If you want to learn more about what would work for you, what you're missing, what your next step should be, I absolutely would advise you to book a call with our team. And there's a link that we'll be throwing in chat and talk to us. We talk to about 100 people a week with these very same issues. We would love to talk to you and ask you the questions and see what is your POTS reports card and what are the areas you really need help in. So go ahead and you could check that. And I want to give you some resources, okay? Meaning that if you want to watch the POTS workshop that I just did a couple weeks ago, put POTS workshop in chat and we'll provide you a link to get access to watch the replay. I did a several hour-long POTS workshop detailing some of these points on how to solve POTS. Go ahead and put POTS workshop in chat. The other thing is, I'm just putting it out there, okay? I'm going to ask you guys a question. Would you guys like me to put together a multi-day POTS workshop / challenge in May for you? Would you like to, you in a room for over several days, go through these areas in POTS in great depth with in person, virtually, in a live POTS challenge, POTS workshop with me? If you would love a live workshop with me, put live workshop in chat. If I get over 100 people over the next 24 hours in social media telling me that they want to work with me live in a workshop, you in a room, we're going to do it. Okay. I know my team's sitting here like, did she just say that? Yes, please. I love it. Megan. Yeah. Put that in chat because this is a multi-day fiesta, like Festivus for the rest of us. All right. So I don't want to shortchange you and do, I know it's been almost an hour, but I don't want to shortchange you with just an hour, even though an hour is a very long time. How about multi-day event? Okay. How about pots and pans palooza? Okay. Maybe you should put pots and pans palooza in chat. That'd be really great. Yeah. Perfect. All right, everybody. So that's a wrap. That's the live for today and this week. I would love to keep the comments going in here, and do one favor for me. If there's anyone that you know that could benefit from hearing and learning from this session, tag them and share this with them. Share this with them, text it to them, tag their name if you're on Facebook with it, so they get to see it later. I hope that was really valuable, succinct and clear and simple. And I also laid out for you what some of the underlying causes and fixes really are. There you go, everybody. That's a wrap. Have a wonderful evening, everybody. Thank you.